So after COVID-19, it was recognised by the staff within residential care that a specific older person's early warning system would be required for their cohort of individuals. Our project identified a tool from the UK which was evidence-based and validated, and we adapted it for use here in Ireland. We tested it in 15 public and private long-term residential care facilities for a 3-month period, and we collected a huge amount of data which has demonstrated that it's given good outcomes for residents and also for the staff that actually look after the residents themselves. So the primary aim of the project was to identify and test an early warning system that would aid the early detection of acute clinical deterioration in older people who were living in residential care. And a secondary aim was to reduce the unnecessary transfer of those residents to acute care. And I suppose that's in line with the principles of Sláintecare, of the right care in the right place at the right time. What we did find when we implemented it, that for the residents, there was a 25% reduction in the transfers out to the hospitals. There was also a reduction in the amount of residents that were admitted to acute care and those that died after an unplanned transfer. And when we looked at the GP transfers with or without a review, they went down by 48%, which was absolutely massive. And when we also looked at the reasons why residents were transferred, there was a 25% reduction in medical emergencies that were not falls related, which demonstrated huge benefits for the residents and those that cared for them. I think the success of this project really was down to the collaboration and co-production with all the stakeholders that we had involved in it. Also, the IRESTORE facilitators that we had within the local facilities, they were absolutely superb, I have to say. Huge thanks for everybody that was involved in the project, particularly the IRESTORE facilitators and the pilot sites that put themselves forward for the pilot. Without them, we wouldn't be in the position where we are now, scaling up nationally